Interestingly, I don't think anybody's ever gotten what they wanted from a shutdown. Ted Cruz generated a shutdown when I first got to the Senate over the funding, ironically, for the ACA. Ultimately, it was defeated and it didn't happen. Donald Trump had a long shutdown over funding for the wall. That happened later, but under different circumstances. But shutdowns don't accomplish anything, and they hurt a lot of people. And also, it's just a failure of, I mean, what the hell are we there for, is to maintain the operation of the government.
So you're in the Senate, so you're closely following everything. I have an impression, I don't know whether it's right, that the Republicans don't want health care reform. They say they do. They're devoutly repeating how much they want health care. But other than to repeal Obamacare, I don't know what the plan is. Is there a plan?
Not that I know of. Apparently yesterday in the White House they said, we have a plan, we're going to, and I laughed because they've been saying, Donald Trump's been saying he's had a plan for 10 years and we've never seen it. 2017,
the first year after his first inauguration, he talked incessantly about, we have a great plan.
Yeah, we're going to have it in we're going to get it in 2 weeks.
We're going to get it in 2 weeks.
Yep.
But it's not just a plan. It's the best plan ever created for healthcare in the United States.
My position on this vote coming up is, okay, you got a plan, that's fine. Let's pass the 1-year extension, simple, clean, and then we've got a year to talk about your plan.
Yeah.
And to talk about other plans and other issues. Listen, healthcare, we got a real healthcare problem in this country, Harold, although my belief looking at it is we've been arguing about the wrong thing for the last 10 or 15 years. We're arguing about who pays, Medicare, Medicaid, ACA, private pay. We ought to be talking about how much we're paying. We're paying twice as much for health care per person than any other major country in the world, twice as much. It's now up to 22% of GDP. Think of that for a minute. One in every $5 spent is on health care in this country. That's unsustainable. And so we really need to be talking more about how do you control the cost of health care, whether it's prescription drugs or utilization or any of those kinds of things. My mission is about prevention. For example, Medicare will pay for your broken hip if you fall down in the shower. They won't pay $10 for a non-skid bath mat so you won't fall down. They won't pay for a grab bar. To me, that just makes no sense.